Hello, everyone, and welcome to this crucial discussion on women's cancer. Today, we focus on the power of early detection, advancements in treatment, and the role of awareness in saving lives. In this virtual session, Think Pink, Act Now, Screen, White, Win, organized by Voice of Healthcare and Cadila Pharmaceuticals. Despite medical progress, many women fear barriers to screening due to fear, misinformation, or lack of access. How can we break these barriers, especially in underserved communities? How can we ensure innovations like genetic testing, precision medicine, and AI driven diagnostics reach everyone? Beyond treatment, cancer care must address emotional and psychological well being. Support systems and education are just as vital as medical breakthroughs. We are honored to have Dr. Khushboo Jain Karnawat, consultant medical oncologist, Karnawat's Cancer Hospital, here with us today to share her insights with what are the advancements shaping future of women's cancer care. Let's engage, learn, and work towards a world where prevention and early intervention can make cancer less of a threat. Welcome, Dr. Khushboo.
Thank you so much. Thank you so much for the kind introduction.
So, Dr. Khushboo, why is early detection so critical in improving cancer survival rate? And can you share some real life cases where early diagnosis made a significant difference?
See, the early detection is the most important thing which an oncologist can offer for a patient's completely cancer-free survival. Because if the cancer is detected in stage 1, for example, we take an example for cervical cancer or breast cancer. If it is detected in stage 1, then the chances of that patient living her normal lifetime, that is almost as good as 98%, 99%. And if the same disease is detected in stage 3 or stage 4, the chances of her survival for her 5-year survival drops down to 20%, 30%. So this is a very big advantage if the cancer is detected in the first stage. Hence, the early screening, early detection is the most important thing an oncologist can offer to their patient. And also, if you want to talk about an example, I will give example of Angelina Jolie, which is a very famous example. She was detected germline BRCA1 positive. That means she has some cancer mutation genes in her blood. So she chose to underwent bilateral mastectomy, prophylactic bilateral mastectomy. That means she decreased her chances of getting breast cancer by almost 99% before even she could have been diagnosed with the cancer. So that is the power of screening and early detection.
Right. So early detection leads to good survival and leading the normal life, as you said. And if you have some germline mutation or genetic testing can help to reduce the risk as well. So, what are the biggest barriers preventing women from undergoing regular screening like mammogram, pap smear, or genetic testing? How can we break these barriers, especially in rural or underserved communities?
Right. If we specifically talk about India, the rural area, the biggest barrier I see is lack of awareness. Because when I talk to the patient and her relatives that there are these options available for which she can undergo regularly, these tests she can undergo regularly, which can decrease her chances of getting like a getting a cancer, or which can help her in early detection and cure. So these patients do not really accept these things very easily. There is a lot of education which needs to be imposed at regular intervals for these patients. So the first and foremost thing is lack of awareness. The second thing is social stigma, because in 2025 also the patients are not really willing to discuss openly about their fears about any breast lump or uh, uh, the bleeding PV, the common symptoms with which they present. So the social stigma is another big thing. The third thing is financial issues, because whatsoever is the case, still these tests are little expensive for our rural patients, rural population. And the fourth thing is the availability of test, because the region from which I belong right now, we don't have mammography units in rural areas. So the patient has to travel around 100-150 kilometers to get a mammography done, which is again adding to the cost of the test, because the patient has to travel so much. So these four things, I think these are the barriers which are causing which are preventing population to get regular screenings.
Rightly said that social stigma, I believe, it can easily be, taken care of, and they should come forward if they have a lump or bleeding TB. They should discuss about it, and of course, accessibility is one thing. Like the way you have said that in rural and underserved communities, some of the tests like mammograms are not available. Okay, so many women also fear cancer screening due to some myths and misinformation. How can healthcare professional encourage routine checkups without causing unnecessary anxiety?
Right. See, there are two biggest myths which I come across in my day-to-day practice. The first one is cancer diagnosis means death, right? If the patient is diagnosed with cancer, that means she is going to die. That is one big myth which I come across. And the second one is that if the patient has got screening done and the reports are negative, that means she is cancer free and she is never going to have that cancer. So these two myths are really like patient really need education regarding these two things. I will address one by one. The first one, see, as I told you, if the cancer is detected in first stage, the chances of living a normal life is as good as 98%, 99% nowadays. So the patient, obviously, the patient education should be there, that even though she is detected with the cancer, there are good possibilities that she will live her normal life. So that is one thing. And the second myth which she has, if once the tests are negative, the screening test is negative, then she's not going to have cancer in rest of her life, so she doesn't come for a second routine checkup. That is a very big thing, which big issue which needs to be addressed. So I think the regular educational campaigns will help this thing, because the population needs to know that cancer can occur in later stage even though the prior screenings were negative. Hence, regular screenings are very important. So, yeah.
That's a very good message, I believe, because once they are cancer free, after taking treatment, whether it's a surgery or a chemotherapy or radiation, and the reports come negative, they don't come for monitoring. So that is a misinformation which needs to be addressed, right? What role does family history play in determining a woman's cancer risk, and how can genetic testing help in proactive healthcare?
That is a very important question, because family history in women's health is very important, since breast cancer, ovarian cancer, these are few cancers which are very frequently associated with family history. Like I have patients who have cancer in every generation of their family, right? So these are very important uh, cancers which in which family history needs to be taken care of. uh, well, the most common genes, which are BRCA1 and BRCA2, these genetic mutations are very common with breast cancer and ovarian cancer. And if the patients undergo these tests, and if they come positive, not only that, there is a screening advantage, the genetic screening advantage for the family, there is advantage for the patients also, because we have targeted therapy available for these genetic mutations. So yes, family history takes it is very important in patients treatment, and also uh, as far as family is concerned.
So, of course, genetic testing is important as far as the screening is concerned, and also it helps us in personalizing the treatment plan as well.
Yes.
So, how do genetic testing and personalized medicine help to tailor treatment to individuals' patient, and are these options accessible to average patient in India?
See, genetic testing is widely available now. It is available anywhere and everywhere because of so many labs we have for genetic testing. But yes, affordability is one thing which needs to be addressed. Although there are many companies which are sponsoring these genetic tests, so but still there is a gap because first thing, if a mother comes with breast cancer and I ask for a genetic testing, she doesn't undergo this test willingly because she thinks that she has two daughters and those two daughters will be affected with her test report. That is one thing. And the second thing is, even if it is ovarian cancer or breast cancer, they think that there is nothing going to be changed after genetic testing. She is once diagnosed with cancer, she will have cancer and she has to undergo the rest of the treatment. So they don't think that genetic testing at that point, when she is diagnosed, at that point it is important for her. So these things need to be reinforced to the patient and to the family, that genetic testing is not only for just for a test sake, it is for the patient because that has therapeutic implication also. And also the future generations need to be prevented from developing cancer based on those tests.
Correct. And what do you think are the most promising breakthrough in breast cancer and ovarian cancer treatment today?
See, we are very lucky that we are in 2025 because we have really good targeted therapies, really good therapies for precision oncology, which are available for breast cancer, ovarian cancer. If we talk about breast cancer, we have HER2 targeted therapy, which is trastuzumab, which was earlier approved for HER2 positive patients. Now we have trastuzumab deruxtecan, which is helpful in HER2 low patients also, which were earlier considered as HER2 negative. Then we have immunotherapy. Immunotherapy works very beautifully in triple negative breast cancers. If we talk about hormone positive breast cancer, I have really good patients who are stage 4 hormone positive breast cancer, and they are really doing very good on just on the hormonal therapy. They are not requiring any chemotherapy. So with minimal side effects, these patients are undergoing like treatment very happily, and they just have to come once a month for their treatment, even in stage 4 cancer. And then if we talk about ovarian cancer, the biggest breakthrough in last decade in ovarian cancer is availability of PARP inhibitors, because which is again BRCA1, BRCA2 targeting drugs, PARP inhibitors. So these have really given good results in prolonging their survival. Good progression-free survival they deliver. So yes, we have good drugs in recent times for both the cancers.
Correct. So we have targeted therapy, immunotherapy. These are available. Survival definitely can be increased. We also have some home-based and non-invasive screening methods for women cancer. What do you think about those non-invasive home-based tests?
Well, see, as of now, home-based tests are not validated in clinical practice. So I would really not recommend home-based test. But yes, there are few tests like breast self-examination, which has proven to be beneficial for the patient, which has to be done once in a month. So yes, self-breast examination is one thing. Then I guess with upcoming artificial intelligence, we will have better test, home based test, which can give us more precise results. And I guess after clinical validation, those will be available for the patients. But as of now, home based tests, I would not recommend those tests because those tests will unnecessarily give apprehension to the patient and will not give results.
Right. So maybe in future we'll have it after validation.
Yes,
And if you have to dispel one dangerous myth about cancer that women believe today, what would that be?
that is cancer means death.
Right, right. Yes, it is. It is one of the
That is
biggest
the
myth, and I
biggest.
believe with the advent of
Yes.
targeted and immunotherapy and personalized treatment plan, we can increase the survival, and nobody should defer themselves from having these treatments.
Very
These are
true.
available.
I recently
Correct.
lost one patient of breast cancer because of this myth only. She was diagnosed with breast cancer in her stage 2, and that was completely curable. But she did not undergo any of the further investigations or treatment just because she thought that she's going anyways going to die. Why to waste her money? So that patient then came after 2 years in stage 4, and we could not save her. But that is a very like painful situation for an oncologist, that a salvageable case was like that was a salvageable case, but she died because of this myth.
Exactly. And people don't, avail the treatments which are available. Of course, we can make it more affordable and accessible. That is
Yes,
one barrier
definitely.
which we can break, right? So, are there any specific lifestyle factors that women often overlook but can significantly reduce their cancer risk?
Yes, one thing is balanced diet. That is really lacking in our diet because women do not take proper protein intake. They do not understand the importance of protein. The diet they have is generally carbohydrates and fat only. So that is one thing. The balanced diet is very necessary. Second thing is the importance of regular exercise, because whenever I ask my patients, those who are cured of cancer, I tell them to maintain a healthy lifestyle, to do regular exercises. What they answer, they give me answer that I do all home, like they do their home work. So their household work they do every day, and that is better than exercise. But this myth has to be broken, because regular exercise really means a lot if it comes to cancer prevention. So these two things, yes, I will, and regular screening. Yes.
Right. So exercise is very important. Maintain a healthy weight, eat
Yes.
well, and get yourself screened also, because the tests which are available are
Yes.
very good, especially the pap smear when integrated with molecular testing. It picks
Right.
up human papilloma virus, and I believe that cervical cancer is preventable with the vaccines being
It
integrated
is
in
totally
universal
preventable.
immunization.
Yes.
Yes, yes. Correct. So, again, I would ask you, with advancement in cancer research, do you see a future where cancer becomes completely curable? Preventable, we have just talked about cervical cancer, but curable.
Cancer is curable. If many of the cancers are curable, so yes, with more advancements, because we are like daily we get some updates about the new molecules which are coming up. With these promising molecules, yes, definitely we are looking for a cure, right? And we being humans, we will not stop at any lower molecule other than the molecule which is going to cure the cancer. So yes, definitely with the recent cancer research, we are going to hope for the cure for every cancer available, although there are many cancers which are still curable, which are curable at present also.
Right. And since you are a medical oncologist, you have been practicing, oncology and treating patients and also seeing their journey while going through oncology treatment. So, what do you think that how important is emotional support and psychological support during this complex journey?
That is one of the most, like I will say that it is equivalent to the cancer surgery, chemotherapy, or radiation therapy. The psychological support is equal, it works equivalent to all these therapies, because the patient at every step of her treatment, the patient needs psychological support. She needs to know that what is going to happen with her, what is her chances of survival, how painful the treatment is going to be. All these things are frequently these questions are asked to us. And also, women being women, they have their concern about their family, their husband, their children. So all these things needs to be addressed, and psychological proper professional psychological support should be provided to patients at the very first at the very first visit of the patient. Since she is diagnosed with cancer, from that very moment we have to provide psychological support.
Right. I would also like to know that in your cancer hospital, so what initiatives have you taken so that people should come forward, right, and get themselves screened, whether you have some educational programs or some health checkups? How do you address this?
We do one camp a month every time, every month. So we do it for free of cost so that rural population can come together for screening. We have some educational activities also, which we do on regular basis. Like for on International Women's Day, we did one educational activity. So time to time, we do educational. Activities, and we have a few displays which are ed- uh, providing information regarding regular screenings, so that the patients and their relatives, or the those people who come to meet the patients in hospital, they can read, they can see in their free time, and they can also get educated meanwhile regarding cancer screening. So these are few things we practice.
Right. And how widely genetic testing is available in your area? Mammogram, you have
See,
said that you have to
yes.
move. So
Hello.
genetic testing, yes, genetic testing,
Uh,
how widely is it?
See, there is no lab which is running genetic test in our area, but it is all outsourced. So we have representatives from every lab which are available in India. So genetic testing is available. Only thing is the people are not so aware, and they are not so willing for to undergo genetic test.
Yeah, yes, correct. Again, from your area only, can you share some real life examples where targeted therapy, immunotherapy, and precision medicine has really helped the patient?
See, if I talk about precision targeted therapy, I would give you an example of lung cancer. I have 45-year-old female who was diagnosed with lung cancers 2 years ago. So she was EGFR mutation positive. We started on targeted therapy osimertinib, and to my surprise, this is 2 years. She had brain mets also, by the way. So previously, it was general norm that if the patient presents with brain mets, the average survival is not going to be more than 6 months. But this is 2 years post her diagnosis. She's currently on the same therapy on osimertinib, which is just one pill per day, and she's doing fine. She's pet complete response. So that is one very good case of precision oncology and targeted therapy, and with minimal side effects. She's not like now. If I ask her about how is she feeling, she tells me that she doesn't feel that she's a cancer patient. So
That,
that is one
that
beautiful drug. Right. And then if we talk about immunotherapy, yes, immunotherapy works wonders because I have a patient of cervical cancer, metastatic cervical cancer. She was treated for cervical cancer in 2014 with radiation and chemotherapy. And she recurred in 2024. So we offered her immunotherapy along with chemotherapy. And after 6 months of her therapy, she is again in PET complete response. Because of some reason, I had to stop im- um, immunotherapy for her because she developed arthritis. But even off drug, she's more than 6 months she's off drug, and still she's PET CR. That is a very big thing. Which is there. So yes, these medicines work wonders for the patient.
and if you have to give advice to women of today that how can they take charge of their cancer risk and overall health, what would that be?
I would tell them to take their health seriously. because women in like in general, women, they are mother, they are wife, they are sisters, they are daughters, but they are not themselves. So I would tell them why there is a need to celebrate a women's day, because there is, because women do not take their health seriously, they do not take themselves seriously. So self love is one concept which is very much in talk nowadays. So women should learn self love, and in self love they should learn to how to take care of their health, and they should undergo regular screenings as advised.
Right, I think that is a very good message that early screening really helps. And if we detect the cancer, especially in stage one and stage two, especially in breast, there we can save the breast, we can do the organ, saving procedures, and
Preservation, yes.
also yes, and also we have the targeted immunotherapies. And you have given a very good example of lung cancer patient. Because I believe that precision oncology torch bearers lung cancer with EGFR mutation and the targeted therapies available for all these, driver mutations. I believe that we can definitely increase the survival, and women also should take care of themselves by getting regular PAP tests done and getting the HPV molecular testing done so that it can be picked up early. And even at the stage of dysplasia, it can be treated, especially the pre-invasive and plastic cancers. They can definitely be taken care of early, and stage one, stage two, they are curable. And I believe that future is good, and there are certain cancers which we would be able to eradicate, especially the cervical cancer, with all the vaccines available. I think it should be there in the immunization program. And a very good
Definitely.
message that women should take charge of themselves, get themselves screened, and get detected early and win over the cancer. Thank you so much for joining us today.
You're welcome. It was nice talking to you. Yeah.
All right.
Bye.